Very good morning and warm welcome to our respected Chief Guest and Chairperson Emeritus of Mahatma Gandhi University, Dr. ML Swarnakar, Vice-Chancellor, Dr. Sudhir Sachdev, Pro-Vice-Chancellor, Dr. GN Saxena, Registrar, Dr. AK Sharma, Members of Board of Management, Shri R.R. Soni, Chief Finance and Accounts Officer, Dr. Shobhit Swarnkar, Principal of Mahatma Gandhi Medical College, Dr. Swati, Mahatma Gandhi Dental College, Dr. Padiyar, Principals of various constituent colleges, eminent faculty members, Dr. B. A. Sharma ji, Professor and Head Neurosurgery, Dr. Nahata, Director of Center for Endoscopic Surgery in Gynecology, other eminent faculty members in the audience, staff members, students, friends who are watching the live telecast of this event online. I wish every one of you a very happy 73rd Republic Day of our great nation and motherland. Prior to this day, in the year 1950, the country was headed by the British monarch, the Viceroy, the Governor General. On this day, in that year, the Constitution of India was made effective by the Indian Constituent Assembly, a body of almost 300 members working for almost 150 days to draft our Constitution, and thereby completing the country's transition towards becoming an independent republic. And since then, we started having our own president. Why 26th January was chosen? It was the day in 1930 when we proclaimed complete Swaraj with the Declaration of Independence. A nation is nothing but a group of individuals willing to follow and be governed by a certain set of ideas, the laws, bound into a scripture, the Constitution, and sharing a common geographical place, the motherland. The beauty of our country is the diversity amongst religions, regions, castes, languages, etc. But even more beautiful is the unity shared by a single common faith, that is our Constitution. It is the duty of our coming generations to ensure that this grows stronger no matter what. How do you serve your nation? Not everyone goes to the armed forces or to political services or through offices of governance. Here, I fondly recall the words of our founder Vice-Chancellor Dr. Hari Gautam ji, that if you want to serve the nation, the most suitable and the easiest way is to put your best effort with utmost sincerity and honesty for the organization you work for. Fortunately and by God's grace, your work directly involves serving the human beings in suffering as well. So it's a double benefit that you get by just putting in your sincere efforts. You get to serve your nation and you get to serve your society. This is a rare opportunity. Let us all utilize it well. I can state with pride that our team of doctors, residents, nurses, paramedical and administrative staff worked tirelessly during the COVID-19 pandemic and are still doing so. I, on behalf of Board of Management, express my gratitude to them. We are in the middle of a third wave, albeit a milder one, but due to the absolute number of cases in the society, there are hospitalizations and sick patients are needing specialized care. Plan for the worst and hope for the best has been the Institute's philosophy. The organization has now built sufficient infrastructure in terms of over 1,000 beds having piped oxygen supply, ICU beds that can be scaled to up to 400 in number if the need arises, almost 150 ventilators, n number of oxygen concentrators, state's largest oxygen generation PSA plant, adequate backup for liquid medical oxygen, and close to 1,400 cylinders. There is adequate stock of required pharmaceuticals, consumables, and protective equipment. Our diagnostic facilities, including the state's first RT-PCR COVID lab, are ready to perform all the requisite tests in-house as we have been doing in the past. The Institute has started a 25-bedded pediatric ICU unit along with a 5-bedded pediatric pediatric dialysis unit and renal transplant unit, catering exclusively to pediatric population in the age group of 3 months to 16 years. The university, apart from providing vaccination to its own staff members, has provided free booster vaccination dose to all doctors of Jaipur and adjoining areas. This year, as has been told by the other speakers, two major accreditation processes have been conducted so far. One is the very exhaustive NAC accreditation of the university, and second is continuation of NABH accreditation of the hospital. The results of both are awaited and will be out after completion of a due and a long process. I would like to thank the core team of faculty members involved in the NAC process, especially in compiling and presenting humongous data and putting over 12 hours a day for most days in a week for months together. Also, our NABH team, who are now a specialized group in their field, smoothly undertake quality implementation and validation process. The university envisions to develop into an institution of excellence at par with global standards in the field of healthcare and allied sciences that is driven by quality teaching, training, research and innovation. I am looking forward to the board of research that has been formulated by the university, by the academic council, and I hope that we now get some quality publications that are indexed in the UGC care list, in the Scopus, and as required by other statutory bodies. Number of publications is the sole criteria by which the university will be judged. There is no second criteria. Number of publications, and we being a medical university, most of our students are placed. So placement is not a challenge for us. It will never be a challenge for us. All we have to do is publish, publish and publish. Paper publications should be directly linked. This is a suggestion to the university, a strong suggestion, directly linked to the promotion and salary appraisals of faculty members, not only in medical and dental, even in allied sciences, nursing sciences and physiotherapy. We should encourage incubation of more number of startups on the campus. If required, we should take help from engineering and management universities, the IIMs, the ISBs, to incubate startups on campus. This is the way forward, this is the way to go. We should apply for maximum patents. Faculty, students who are working towards patents should be given very special attention and very special benefits. Something like this should be formulated by the Board of Research and by the Academic Council. As stated by the previous speakers, the university now has permission for 250 MBBS and 100 BDS students. The counselling for the same is underway. I congratulate everyone involved in the process. The total number of PG seats in our university are over 150 and 60 seats in DM and MCH. We are offering some of the unique programs in MD, MS, DM, MCH in the state, like hepatopancreatobiliary surgery, only the second institution in the country to do so, interventional radiology, critical care medicine, organ transplant anesthesia, nuclear medicine, family medicine, palliative medicine, trauma surgery, to name a few. These courses should be propagated amongst the prospective student community through advertisements and word of mouth, so that we are able to fill all of them and to drive the course further. Also, I would like to request the Vice-Chancellor and the Registrar to expand the horizon of new courses being offered at our universities in untouched disciplines like biotechnology and genetics, and to spread the utility and popularity of our courses, especially in hospital administration, health informatics and other paramedical disciplines. There is a lot of scope. We can have a lot of student intake in that. We should propagate it with utmost sincerity. I would like to congratulate and convey my best wishes to the liver transplant team, GI surgery team and hepatology team for establishing life-related liver donor transplant program. I can safely say the program has now been established. We are performing close to 3 liver transplants every month with excellent results. Our bone marrow transplant program, both for neoplastic conditions and thalassemia disorders, is doing well. I wish them all the best for the future and assure them all the help required from the management's end. I can very well foresee Mahatma Gandhi Hospital as an extremely busy healthcare facility in the coming few months and years. Best quality of medical care requires highest standards of nursing. like year 2021, year 2022 also be dedicated towards drastically improving nursing care to the best of standards. We being a medical university have a lot of mandatory deviations. We have to go for NMC inspections, we have to go for NAC accreditation, we have to go for NABH. All these things will continue. But our commitment towards improving nursing care, improving ancillary medical care should not get deviated. We should form a separate team and we should have a unidirectional focus in improving these areas. With over 850 nursing personnel, it is not possible without the active cooperation of all the stakeholders. I request all the head of the departments, specialized departments like neurosurgery, cardiac surgery, oncology, to participate in training and teaching of nursing program. Their retention, appraisal is the duty of management. We'll take care. But teaching, training, behavioral has to be taken care by the nursing admins, by the hospital administration, and by the clinical heads. Let us all come together and achieve this target. Today we are missing the presence of a founder chairperson, Dr. RP Sonawala, a larger-than-life figure in obstetrics and gynae, and a life guide to my father. In the interest of safety, he is not joining us and he is keeping safe in Mumbai. I can say with pride and humility, it's the vision and guidance of our chief guest, my father, Dr. ML Swarnakar, that is propelling this magnanimous project forward. He is the energy behind this great organization. He is not only God-gifted, but has extreme dedication and perseverance for any task he undertakes. Not only mentally, even physically, he works hard than most of us in the organization, making this a perfect possible recipe for success. Last but not the least, it's the blessings of my mother, Srimati Meena Swarnkar, the Vice-Chairperson of India Education Trust. She has been a rock-solid support system for my father. The values of honesty and integrity instilled in us by her are the true driving force behind this great institution. Happy Republic Day once again. God bless every one of us. God bless Mahatma Gandhi University of Medical Sciences and Technology. God bless our country. Jai Hind.